This is quite a big U-turn. Even Hong Kong, we don't see things like that.
I think this reflects how hard COVID has hit China since the exit from COVID zero. We have infections spreading very broadly across the country here in Beijing. There's very little traffic, stores are closed, shops are closed. We've got reports, anecdotal evidence of factories being slowed because of outbreaks on production lines. And here in Beijing, we also had hospitals asking doctors to come in and work, even if they tested positive for COVID, but had mild symptoms. And so, again, I think this is a reflection of how quickly the virus has spread and how very much the government wants to keep things going if it can.
John, how much of this headline, to your point on Chongqing, is something that we might see nationwide?
So we've had some reports this morning that other cities have done similar. They've asked people to continue working, even if they've tested positive for the virus. Again, I mentioned, hospitals in Beijing here are already doing that with doctors and nurses. I think it will continue. We had earlier last week, Zhou Nanshan, probably the most influential epidemiologist here in China, saying Omicron is essentially a cold. And so there's been an effort in the public to try and downplay the seriousness of the virus, of infection, and trying to get people working and trying to, get an economy that's been knocked pretty much on its butt back on its feet.
Yeah, I mean, John, to that point, it doesn't mean because one is allowed to go to work, one can go to work. I mean, people will catch the virus. Are we inevitably going to see some slowdown in activity, if not already, because of just this spike in cases these next few weeks or so?
I think the slowdown in activity is almost certainly going to be reflected in the numbers that we get for the economy for December, probably for the first few months of the new year. People are calling in sick. Lots of companies have reported that businesses have had to close operations because of a lack of staff. People are not going out and shopping, not going out and spending because either they're sick or they're afraid of getting sick. And that I think is going to take some time to work through the economy.